Okay, so Assalamu alaikum. In this video, we'll take a look at the remaining topics of the breast, that is the blood supply, the nerve supply, and the lymphatic drainage of the breast or the mammary gland. So, as far as the blood supply is concerned, so the main arteries from which the blood supply is being obtained for the breast tissue is the internal thoracic artery, which is the branch of subclavian artery, which is in turn is a branch of the arch of aorta. The other is the branches from the axillary artery, जो कि basic subclavian artery at the end बन जाती है axillary artery when it crosses the pecminal muscle, etc. And then there are also some branches from the posterior intercostal arteries. So basically internal thoracic artery कुछ उसकी branches होती हैं, right? And then some branches of the axillary artery, which are thoracochromial, superior thoracic and lateral thoracic, right? And then there are some branches of the posterior intercostal arteries, which are the lateral branches from the posterior intercostal arteries. So posterior intercostal arteries की lateral branches, thoracochromial, superior thoracic or lateral thoracic branches of the axillary artery, and the internal thoracic artery, which is a branch of the subclavian artery. These उसकी कुछ perforating branches होती हैं. Basically some, I think 4 to 6 perforating cutaneous branches are the branches of the internal thoracic artery which is supplying the breast tissue. So ये होगी सारी important blood supply. अगर बात कीजिए about the lymphatic drainage, so the venous drainage, this is basically arranged in a form of superficial and deep sets. The superficial set होगा, it will be draining mostly into the internal thoracic vein, while the deep veins will be draining mostly into the axillary and posterior intercostal veins. So in this way the two superficial and deep venous plexuses will be draining the breast tissue, right? So ये होगी उसकी and again once again you can see that subclavian artery से आ रही है हमारी वो वाली internal thoracic artery, and axillary artery से thoracochromial, lateral thoracic and superior thoracic arteries आ रही हैं, and then there are some lateral cutaneous branches from the lateral perforating branches from the internal thoracic artery as well. So as far as the nerve supply of the breast tissue is concerned, so this is mostly obtained from the anterior and lateral cutaneous branches of the 4 to 6 intercostal nerves. ये हमने cutaneous nerves of the pectoral region में भी हमने study किया था, but once again we should know that 4 to 6 intercostal nerves की anterior lateral cutaneous branches will be supplying the nerve supply to the breast tissue, and these are basically conveying the sensory fibers to skin and autonomic fibers to skin, bone, muscle and the blood vessels. Okay, so the next and final topic is the lymphatic drainage of the breast, which is very important because जितने भी metastasis होता है कैंसर का वो हमेशा lymphatic drainage के ज़रिए ही होता है. So from that regard it is quite an important topic, and there are certain groups of lymph nodes which are present in the pectoral region and they will be draining the breast tissue. So the first group is the axillary lymph nodes, जिसके further आगे parts होते हैं, that is the anterior pectoral group, posterior, lateral, central and apical. So there are 5 parts of the these axillary lymph node, that is the anterior, posterior, lateral, central and apical groups of lymph nodes, right? जो कि directly and indirectly breast tissue को drain कर रहे होते हैं, उसकी lymph को drain कर रहे होते हैं. And second group is the internal mammary or the parasternal group of lymph nodes, and ये भी along the internal thoracic vessels बड़े होते हैं. And the third one is the supraclavicular lymph nodes. These are the most important ones, ठीक है? Axillary, internal mammary और supraclavicular. इसके अलावा कुछ और भी होते हैं, that is the cephalic, posterior intercostal and subdiaphragmatic lymph nodes, जो कि different regions of the breast को drain कर रहे होते हैं. अच्छा, अगर बात की जाए lymphatic vessels की, so just like the venous drainage, the lymphatic vessels are also arranged in the sets of superficial and deep sets. The superficial set will be draining the skin of the breast, but not the nipple or areola, right? While the deep set will be draining the remaining parenchyma or the major bulk of the breast as well as the nipple and areola, right? So कहा जाता है about 75% of the lymph from the breast will be draining into the axillary lymph nodes, 20% into internal mammary and 5% into the posterior intercostal lymph nodes. इससे उसकी division हुई होती है. And internal mammary lymph nodes में कहा जाता है that it drains not only the inner half but also the outer half of the breast as well. And just deep to the areola there is a you can say a plexus or you can say circular plexus of lymph vessels called as the subareolar plexus of Seppi, which drains the lymph most of the breast, and ultimately it drains into the anterior या pectoral group of axillary lymph nodes, right? And then जो deep tissue होता है breast का, वहाँ से जितना lymph होता है just crosses the clavipectoral fascia, crosses the pectoralis major muscle. अभी हम इसको बाद में स्टडी करेंगे कि कहाँ पड़े होते हैं, कैसे होते हैं. And ultimately it will be draining into the internal mammary lymph nodes or the apical group of axillary lymph nodes, right? And the final point is that जो inner half या deeper aspect of the breast से जितना भी होता है lymphatic drainage, it will be going after crossing the costal margin to the subdiaphragmatic or subperitoneal lymph nodes of the anterior abdominal wall, right? So these were the lymph nodes and the lymphatic drainage of the breast, and the blood supply and the venous drainage and the nerve supply of the breast. So I hope it was helpful for you. Thank you so much. If you liked it, then like it and subscribe the channel. Thank you so much. Allah